They do it with patient supine, but it's very difficult to do a hip spica, and that will be that's the way you're anchoring it, supine, because they have to do a bridge and you have to get underneath. But for a patient themselves, they really can't do it sideline. So you might have to teach them to do it supine, okay? But again, they have to bridge, they have to slide it under here, and so it's a little more difficult. So sometimes I have seen therapists do all of their wrapping here first with a 4-inch, and then they would take a 6-inch and cover it. It's not terrible. It's just another way of doing it. If you find that works, because sometimes if it's a very thin residual limb, a very short residual limb, these 6 inches are just too big. So you play it by ear. But for us, for purposes of this course, we're going to do 6-inch. Okay. So let's start up here laterally. My first wrap is going to be all the way up in the groin. Okay, and I'm behind this patient because I want to pull back into extension. If you ace, whichever way you're pulling the elastic is how you're going to pull the joint. Yeah.
When you're doing this, do you have to worry about like what clothing you have?
Okay, it's a good question. Usually what I do is I will let them take their underwear down on this side. I'll give them a drape, and they take care of all that stuff, and then I come in and do it.
All right, so this is on the skin.
This is directly on the skin, yeah. So the underwear is down on that side, and then you can drape it. They can drape themselves wherever, okay? And that has to be exposed, and then they can put their underwear on so that they can, go to the bathroom and stuff and won't interfere. It's a good question, yeah.
You have to worry about when you go up into the groin, if you get into like the crease, does it cause any breakdown?
It shouldn't. If it tends to be rolling up, then maybe it's too tight, and you have to change it more often, okay? Because if I'm not that high, okay, then the adductor tissue tends to come up and they end up with an adductor roll. So I like to get as high as possible, okay? It's intimate. There's no way around it, so you want your patient to be as comfortable as possible, to drape themselves so they are as comfortable as possible. You're a professional. They're there. They usually don't give you a hard time. If a man does not want a woman to do it, then you need to find a man to do it, okay? And vice versa. So you be as sensitive as you can. You be as practical, as official and professional as possible, okay? So the first one got that. Now I like to do my spica. A spica is like a figure of 8 that goes around the pelvis. I like to do that first. And now I'm going to go down. I've already gotten here. I have one here, and I like that. Now I'm going to go down and get here. Okay. I'll give you a second. Now, for some reason with this level, I get both of them at first, but it doesn't have to be. Okay. These are very big bandages, so you may find you have too much bandage. So now we can do okay, so that's one down. Okay, again, I want to be at a right angle. And now I can get the rest of the bottom. It's a lot of bandage, so I might do another spica with this bandage. These are doubles. So. Okay? Have you guys, any of you seen pacing in your films? Okay. Did you get a chance to do it?
I did. It was for
Okay.
an ankle.
Oh, an ankle? Any amputee? Okay. And that can end there, or you could go around one more time with your choice. Okay, and then I would take it. Questions? Okay, so this is a really poor position for the hip. I would never actually wrap in this position. I would really want them to be in a deduction and extension. But you couldn't, they just, because they had